atherosclerosis is the commonest cause of death around the world. It causes heart attacks. So if you have atherosclerosis in your coronary arteries, you block a coronary artery, you have a heart attack. If you've got atherosclerosis in the blood vessels going up to your brain, particularly the carotid arteries at the front, and you block one of those, that's where you see the people who have what we call a hemiparesis. They're paralysed on one side, they can't speak properly, and they can be, it's a very, very dramatic presentation. And that is caused by all the major risk factors for heart disease: cholesterol, blood pressure, cigarette smoking, diabetes, pre-diabetes, and obviously a strong family history, which can affect the coronary arteries, giving you heart disease, or affect the cerebrovascular arteries, giving you stroke.
Welcome to the Eat, Live and Move podcast by Miyagi, a space where we bring you the latest science-backed conversations, expert insights, and practical tips relating to all things health and wellness. Hello, I'm Dr. Gina Cleo, your personal habit change expert.
And I'm Dr. Ross Walker, cardiologist and preventative health expert.
And together with our 60 plus years of collective experience, we're on a mission to help you to improve your health and transform your habits so that you can eat, live and move better one episode at a time without the fluff or the fads. Today, we're going to talk about all things relating to stroke. In 2021, stroke was recorded as the underlying cause of 8,500 deaths, accounting for nearly 5% of all deaths in Australia. Stroke was one of the 5 leading causes of death in Australia. So on average, 23 Australians died of stroke each day in 2021. 1 in 4 people globally will have a stroke in their lifetime. So it's really important that we have a chat around stroke, that we know a little bit more about it for everyone around the world, obviously not just in Australia. So we want to talk about what the causes are, what the different types of strokes are, and the symptoms to look out for, and of course, what to do to reduce your risk. So make sure to hit subscribe. And Ross, I want to start by asking the obvious. Can you tell us what actually is a stroke and what causes it to occur?
Sure. Well, firstly, a stroke is divided into 2 bits, but both bits are what we call cerebrovascular accidents. So they're a problem with the blood vessels going to the brain. So you can have what we call a hemorrhagic stroke, which strangely is where you bleed into the brain. So typically you rupture an aneurysm, your blood pressure's too high, you bleed into the brain. Or almost the opposite of that, you can block the artery, not rupture the artery, and have what we call an ischemic stroke. Ischemia means lack of oxygen. So some sort of clot or something like that blocks the arterial supply somewhere in the brain and can cause some sort of irreversible neurologic defect, or if you get to a hospital quick enough, it can be reversible, which is a key point for later on. But that's basically what it is. But what actually causes that to happen is a completely different issue.
I'm assuming that there are things that we can control and things that we probably can't control, right?
Sure. Well, what I'd like to do first is discuss the hemorrhagic stroke that I've almost alluded to already. We'll not dismiss that one, but get that one out of the way, then focus a bit more on ischemic stroke, which is a bit more common. So hemorrhagic stroke is typically, not always, but typically related to aneurysms. Now, what are aneurysms? Aneurysms are little blowout in the wall of arteries, and they're basically genetic weaknesses in the wall of your artery. So when you think about a tire blowing out, well, the same thing can happen with a blood vessel in the wall of the blood vessel. And that's what happens. And depending on the size of the rupture and the amount of blood that goes into the brain will then relate to the symptoms people have, the prognosis, how well they recover, and tragically sometimes people don't survive that. So what are the symptoms of a hemorrhagic stroke? The symptoms are very sudden onset of severe headache, localized neurologic problems, and sometimes you can bleed so much into the brain that could compress the brain tissues down, and then unfortunately you go into a coma and sometimes don't survive.
So you mentioned neurologic problems. What do you mean by that?
Well, what I mean, basically what we call lateralizing symptoms. So someone can suddenly lose their speech, or suddenly become weak down one side, or suddenly have visuals disturbances, something like that. So anything new that you don't know what's going on, you say, gee, I can't use the left side of my body, or I'm getting these dreadful pins and needles down one side. Not always a hemorrhagic stroke. That could also be an ischemic stroke as well. But as I said, it's blood pressure, it's cerebral aneurysms. They're the things that are related to this hemorrhagic stroke. Needs urgent treatment and sometimes can be resolved completely.
Okay, and would that be one of like the first symptoms that someone might notice, or have they noticed other things and this is now a progression?
Well, if for example, they have an expanding aneurysm that hasn't ruptured as yet, they might be just getting intermittent headaches, as one example. And that's one way they may know that they have an expanded aneurysm, but it's not that common. The common presentation of an aneurysm is a sudden rupture with sudden onset, dreadful. We're talking a headache that just comes on like that and is so excruciating. And that's where you need to get to a hospital urgently for the hemorrhagic stroke. So let's now move on to the next category, which is ischemic stroke.
So I just want to make a note here. You would know the difference between that kind of headache and just like your everyday type of head, like the dehydrated headache.
Sure.
You're saying this headache is much worse.
No, this is big league headache.
Okay,
We're not talking about,
like
gee, I've got a bit of a headache, I don't feel that well here. That's not hemorrhagic stroke.
Right, got you.
Hemorrhagic stroke, we call it a thunderclap headache. It just comes on boom like that, and it's really severe.
And does it come with any sort of visual effects as well? You know how sometimes you get a headache and you're like more sensitive to light, or your eyes might hurt. Does it come with anything else, or is it just like a badass headache?
Yeah. No, this is the badass headache. No,
okay.
it's and look, it may have some visual side symptoms with it as well, but it's not the problem. The prominent thing is that headache is number one. That's really driving you nuts. And often when you get to the hospital, your blood pressure's through the roof as well. The key, the quicker you get to the hospital, the better.
Got you. Okay. All right. Moving on to the other type of stroke.
Ischemic stroke. Now, I want to discuss this in 5 categories, okay? Because there are 5 different types of causes for this ischemic stroke. Now, the number one cause that we need to discuss, which is probably not the most common, but it's the one that a lot of people understand, is what we call the atherosclerotic stroke. Now, atherosclerosis is the commonest cause of death around the world. It causes heart attacks. So if you have atherosclerosis in your coronary arteries, you block a coronary artery, you have a heart attack. If you've got atherosclerosis in the blood vessels going up to your brain, particularly the carotid arteries at the front, and you block one of those, that's where you see the people who have what we call the hemiparesis. They're paralyzed down one side, they can't speak properly, and they can be, it's a very, very dramatic presentation. And that is caused by all the major risk factors for heart disease: cholesterol, blood pressure, cigarette smoking, diabetes, pre-diabetes, and obviously a strong family history, which can affect the coronary arteries, giving you heart disease, or affect the cerebrovascular arteries, giving you stroke. And again, same message for the hemorrhagic stroke: get to that hospital immediately, because now, just for example, you rupture a carotid plaque here that's got a big blockage, and you send clots down into the rest of the brain, and you suddenly can't speak, or you suddenly can't move one side of the body. We can now go in through the artery in the groin or the artery in the wrist, go up to the brain and remove the clot. It's called a thrombectomy, and that can absolutely cure the stroke. So please, we always talk about the FAST routine. So the FAST regimen is firstly something going wrong with the face. Your face is drooping, your arms, your speech, and T is for time. Time is brain. The longer you wait at home when you see sudden onset weakness down the face, weakness down the arm, speech disturbance, the longer you wait, the more brain you damage. The quicker you get to the hospital, the better off it is. So that's atherosclerotic stroke. We'll talk about management in a second.
Ross, you mentioned going to the hospital. I'm assuming you can't like drive yourself to the hospital, right?
No. That's
terrible
what
idea.
You ring 000, you say, or you or your relative rings 000 if you're not able to do so, and says, look, I think I'm having a stroke. I really need to get to the hospital. Okay. They will have the ambulance, the paramedics on the way to get you there. No one should ever drive themselves in that situation, because you may involve yourself in a major accident because you've lost your coordination, not just kill yourself, but kill other people.
Got
you
you.
must call the ambulance.
Do you find that, like in the comparison, say, between men and women, that men might hold off a bit longer to go to the hospital than women? Do you know if there's any data around this?
I can't quote the data, but I can tell you from personal experience, women are much better at reporting any symptoms about anything, not just stroke, than men. So men tend to sit on things and use the she'll be right principle, sweep it under the carpet and deal with it in the morning. Oh, it's 2 in the morning. I don't want to get out of bed. I'll wait and see if I'm better in the morning. That is the worst thing you can do.
It's so bad. The other day, my dad ended up in hospital. His blood pressure was 70/40.
It's a bit low.
The doctor, it was so low. And the doctor's like, your kidneys aren't working. And he was just dehydrated, right? He's got emphysema, so he doesn't like to get up and walk around too much. So he's getting lazy, didn't want to get up and go to the bathroom. So he just decided not to drink for a while. And for about 2 days, my mum was like, you need to go to the hospital. He's like, I'm fine. It's fine. And then like on the 3rd day, he was like, I think I need to go see someone. She's like, finally. And the doctor was like, what made you wait so long? And she's like rolling her eyes.
He's a male. That's what made him wait so long.
He's an old, stubborn old man. That's what he is.
That's men. So let's move on to number 2.
Yep.
Number 2 is called a lacunar infarct. Now, most people haven't heard of this, but that's typically related to a marked increase in blood pressure, which then tends to damage more the peripheral arteries within the brain. Very dramatic presentation, but if you get into the hospital and they manage the blood pressure and get you under control, often the dramatic symptoms that you're presenting with can be reversed. Another good reason why you should get to the hospital as soon as possible. It's number 2. Number 3, and this is probably the commonest cause of stroke, and it's not spoken about enough, is a condition that I see in my own practice 3 or 4 times a day at least, called atrial fibrillation. Now, atrial fibrillation is the commonest rhythm disturbance in the heart. So basically, most of us know the heart's got 4 chambers, 2 at the top, 2 at the bottom. The 2 at the top are called the atria, right atrium, left atrium. 2 at the bottom, the ventricles, right ventricle, left ventricle. So all day, every day, the heart's going boom, 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 boom. That's normal. That's sinus rhythm. When you go to atrial fibrillation, the top chambers just quiver and the bottom chambers just bump all over the place. So when the top chambers quiver, little clots can form and then flick up to the skull. And that's a third of the cause of stroke. It's got nothing to do with cholesterol, but it's got everything to do with atrial fibrillation. And that's where you need very strong blood thinners. We have 3 new very strong blood thinners, much better than aspirin. Aspirin does nothing to this at all. And this is why it's really important we're having this conversation, and why it's really important that people know what type of stroke they have, because the treatment for each type of stroke is different. So, and you may not even know that you've had atrial fibrillation, but that's still the cause of your stroke. A third of people don't even know they get atrial fibrillation. So what causes atrial fibrillation? This should be a topic of another podcast, but just briefly, 1% of people up to age 50 have had a clinical episode of fibrillation, 5% 60, 10% 70, 20% 80. If we all live to 150, and thank God at the moment we don't, but if we did, we'd all be in atrial fibrillation, because the electrics at the top chambers, the 2 thinner chambers, start to wear out as we get older, made worse by high blood pressure, alcohol, thyroid disease, a whole lot of other conditions as well, a whole lot of cardiac conditions, but that's, again, should be the focus of a podcast by itself. So that's atrial fibrillation. Now we're moving on to number 4. Now this one's going to surprise you. This is where there's a communication between the right side of the heart and the left side of the heart. 1 in 4 people have a thing called a patent foramen ovale. Now that sits between the right atrium and left atrium, and it was open during utero, when you're in your mother's abdomen, because you were getting your blood supply from the umbilical vessels, the placenta into the umbilicus across this foramen ovale into the left side of the heart, oxygen pumped to the body. When you take your first breath, that little flap closes, and so there's no communication between the right atrium and the left atrium. But in 1 in 4 people, we're talking about incredibly common condition, there's that little communication still, but because the pressure on the left side is more than the pressure on the right side in the atrium, the blood goes from the left to the right. But here's the problem. At the wrong time, if you cough, sneeze, or strain when a little clot comes up from your legs, and these days with the sedentary lifestyles people live, or if you have prolonged immobilization, many people are getting little clots in their legs, which is why we shouldn't be sitting all the time, because there's a condition now called thrombosis, which is getting clots in your legs from sitting in front of a damn computer all day. And so unless you get up and move around, those little clots can come up, and if at the wrong time, cough, sneeze, strain, you can increase the pressure to the right side, push it over the left side, up to your skull. Let me tell you a story. A very good friend of mine, he's been a family friend for many years. His wife's a general practitioner, and they live in the country, and he had a stroke at the age of 50. And his wife rang and said, he's in the hospital. I won't say where it was, but he's in the hospital. He's having a stroke. I said, what are they doing for him? They're giving him aspirin. I said, no. I said, I want him down to Sydney. We got him down to Sydney. I got some of my colleagues to do some tests on his heart. We found the hole in his heart. It was closed with a procedure, a little umbrella device put over the flap. So it was closed. His stroke was then cured. He recovered completely. His life's now back to normal. But had he been left on just aspirin, he probably would have had more clots, more strokes, and then become disabled from it. So it's really important to know, do you have a patent foramen ovale, which can be detected with cardiac tests, and then it can be closed if you need it closed. So that's number 4.
Is that something that a GP can arrange, or like how would somebody be able to do that? You've got to be referred to
someone like me. You've got to be referred to a cardiologist to get it sorted out. But it's not difficult to sort out, I can assure you. The tests we do that detect this foramen ovale to see whether there's a leak across it.
And so it's a fairly common test, or would you have, how would you determine, I should test this person for this?
The first thing we do is an ultrasound of the heart, a transthoracic echo, and often you can see it on that. But sometimes you need a thing called a transesophageal echo, where you put off to sleep, a tube is passed down the throat, and you get these beautiful pictures of the back of the heart when you do that. And it's a minor invasive procedure, and it gives you this important information that may really determine the rest of your life. So that's number 4. So let's finish.
Yeah, give me number 5.
Number 5 is what we call a thrombophilic state. Now, what that basically means, and see, everything in life's on a bell-shaped curve. There are people who are incredibly tall, people who are incredibly short. Most of us are somewhere here in the middle. And it's the same thing with every characteristic. There's clotting and bleeding. So there are clotters and there are bleeders. 1% of people are born with a genetic defect in their clotting, which makes their blood thicker than the next guy. So, for example, someone sits on a plane from here to Heathrow and ends up with a big clot in their legs called the economy syndrome. They want to sue Qantas. They actually should be suing their relatives for giving them the genes that made them have thick blood. It's not Qantas's fault. It's their relatives' fault for giving them those thick genes.
Do you think the Qantas insurance knows this?
No, they don't, but they should. But a young woman, for example, in her 20s goes on the oral contraceptive pill and within a month has had a stroke. She wants to sue the pharmaceutical companies because she's had a stroke. Again, she should be suing her relatives who've given her the genes that thicken her blood. The contraceptive pill just pushed her over to this very severe clot form, and there obviously she can't take the hormone, any sort of hormone replacement, because that will thicken her blood in her case. And there are simple tests you can have in that situation to see whether you have one of the common blood clotting disorders. There's a thing called factor V Leiden, prothrombin complex, anti-cardiolipin antibody syndrome. So all of these things are part of the blood clotting system, which can then predispose you to stroke as well. So I've just basically given you a pretty extensive overview of the 5 different categories of ischemic stroke. I'll say them again just for completeness. Number 1 is the atherosclerotic stroke. Number 2 is the lacunar infarct, the blood pressure related thing. Number 3 is atrial fibrillation. Number 4 is the patent foramen ovale, hole in the heart. And number 5 is a clotting tendency. So they're the things that actually cause stroke, ischemic stroke.
Fascinating, Ross. I love how you can just recite things like this. And I also have noticed you love the number 5. There's a lot of 5s.
Think of it logically. Everything's in 5. You've got 5 digits. You have 5 senses. There are 5 seasons if you count Frankie Valley. Everything's in 5s.
Nice try with that one. Ross, you brought up the contraceptive pill. So say a young woman wants to go on the contraceptive pill but has a family history of stroke. Would that be a contraindication, or would that just be something that you'd want to monitor while you're on the pill? Or like, what happens then?
That's a magnificent question. And can I say, it really depends on who's had the stroke and when they've had the stroke. So just say, for example, you've got a family history where your mother or your father or a sibling has had recurrent DVTs or has had pulmonary emboli or a stroke, then there possibly is a strong clotting tendency in your family. So you're a 22-year-old woman and you think, look, I'm going to start taking the pill for the variety of reasons women take the oral contraceptive pill, but you've got that family history. Personally, if I was your doctor in that situation, I'd be getting this thrombophilia screen to see if it's safe for you to go on the pill. And it is a moderately expensive test unless you've got that history. If you've got that history, it is covered by the Medicare system. And I think it's an important thing to do with that family history. I don't think that it should be a routine for every woman in their late teens, early 20s who wants to start the pill to go and have that test. That's just not cost effective. But the family history is important. But just say your grandfather had a stroke at 85, that's not what I'm talking about. What I'm talking about is a pretty strong family history of clotting of any sort. Doesn't have to be stroke. That's where I'd be going off and having the test done.
That's a great differentiation to know. Okay, what about this? What if it's like a 16 or 17 or 18-year-old girl? Because I know that a lot of young girls want to go on the contraceptive pill, say for their acne or their skin. Would you want to do the same test for a young person compared with, say, like a 40-year-old woman who wants to go on the pill? Like, are the parameters the same?
Same parameters. It's you've got to always look at family history, which is why it's so important that every good doctor takes a good history, and not just a history of that person's health, but a history of the health of their family. And can I just bring in another little point here? And I don't want to get into the pro-vaccination COVID nonsense that people have carried on over the past few years. But when the vaccines came out for COVID, there was this big hoo-ha about the AstraZeneca vaccine causing clotting. But it was my hypothesis, based on the science around this, that the reason for that is there's this condition that I've mentioned called the antiphospholipid antibody syndrome, which is a disorder. It's a bit like lupus, where you get antibodies to a thing called platelet factor 4, which is one of the platelets are the little sticky elements that form clots with clotting factors. And so this is what happened with antiphospholipid antibody syndrome, which occurs in about 5 per 100,000 people. But and this is my theory, the AstraZeneca vaccine absolutely works on platelet factor 4, exactly the same thing. So the people who were getting clotting with the AstraZeneca vaccine almost certainly had some degree of antiphospholipid antibody syndrome, and the AstraZeneca vaccine just stirred that up. But that was only 5 per 100,000 people. So we have taken off, I believe, the best vaccine we had for COVID, much better than the RNA vaccines, purely because of this rare complication in people who had the rare condition. And that was just another interesting aspect, not really to do with stroke, but some of these people were having strokes after having the AstraZeneca vaccine. And I think because they had antiphospholipid antibody syndrome.
Oh, that's so interesting. I've always been interested in the idea of having a genetic test. Like, you're talking about all these DNA tests and these potential of like mutations. And I know that you can send off and have, all the different things measured. But I also think that I'm probably the kind of person who would start to symptom check. Like, say, I don't know, there's like heaps of diabetes in my family, for example.
Yeah.
The moment
it has to be because you're from Egypt.
Well, and there is.
Insulin resistance. There you go.
Oh, my God. Ross.
I'm telling you. That's what it is.
It's true. No, it does. It happens. Both my grandparents had type 2 diabetes and they died quite young. Thankfully, my parents are still good. But the point is, I feel like I would symptom check. I'd be like, ooh, this is going to happen, or I'm going to get this, or like I almost feel like I would overdiagnose myself if I actually knew all the genetic mutations. probably not enjoy life as much either. I'd be like, oh, I can't have this, or I shouldn't eat that.
But you know, the epitaph on the hypochondriac's grave said, "I told you so." Yeah, but still, hypochondriacs still get symptoms, and sometimes they do need to be assessed. We know the little boy who cried wolf, so you still have to listen to what people say to you. So,
I mean, I'm not a hypochondriac. I just feel like I would want to be diligent in ensuring that I'm preventing potential, genetic things. But yeah, I also do think that it can cause an overdiagnosis. But obviously for a lot of people, it saves their lives. I'm sure if a lot of those people knew that they had this mutation, they wouldn't have taken the AstraZeneca
absolutely.
vaccine.
Absolutely. If they knew but with that, it could have been diagnosed from just looking at their blood count and looking at the platelets. So there's a whole lot of other things to do in that. That's a bit of a sidelight, but let's get back to stroke.
Okay. I wanted to ask you, Ross, are strokes preventable? Like even with these genetic mutations?
Can I say, especially for people over the age of 65, 90 to 95% of strokes are related to blood pressure and atrial fibrillation. So if you treat blood pressure well and treat atrial fibrillation well, so for example, all people over the age of 65 who have atrial fibrillation should be on one of these strong blood thinners. Now, everyone listening to this has heard of warfarin, the old style, though people called it rat poison. It actually isn't. The active component was used in lethal doses to kill rats, but in humans it's used in smaller doses to thin the blood. But it was a real pain in the butt to be on because you had to have regular blood tests, watch what you eat, what pills you took, how much you drank. Whereas these new drugs we call Eliquis, Pradaxa, and Xarelto, these new drugs, you don't have to have blood tests. You don't have to be as diligent with the food you eat and alcohol and the medications you take. And they've been an absolute boom for the treatment of atrial fibrillation to stop people having stroke, because that's the key. That's the key. So basically treat atrial fibrillation, treat blood pressure, but the message that you and I give everybody, it's not just about medical treatment. It's still the 80-10-10 rule. 80% of your management is still how you look after yourself. Those 5 keys of being healthy, I'll just go over them again quickly. No addictions, good sleep, good eating and less of it, 3 to 5 hours of exercise, and most importantly, happiness. That is 80% of everyone's management. And I've never seen one person in 40 years of practicing medicine had a heart attack, stroke, stent, bypass, whatever, who wasn't under some form of stress at the time. And so people whose life was going along well and they were looking after themselves well, they just don't get these problems. So there's always a stressor that precipitates it. So you've got to look at your lifestyle, but you've also got to look at the management that you get for all the other things, and look at your family history and have the right checkups.
So I guess with family history, we can't change that, but lifestyle, we obviously can. So there are plenty of modifiable risk factors.
Oh, no doubt.
And the first one you mentioned,
have medical treatment as well.
Of course. The first one you mentioned is, quitting addictions or managing addictions in your life. And I'm guessing one of the biggest ones, of two really, is smoking and alcohol when it comes to stroke. Can you tell me a little bit more about smoking? How does smoking impact stroke risk?
Well, how smoking impacts stroke risk is very straightforward, because the biggest organ in the body, if you're playing Trivial Pursuit, is the skin, and that's wrong. The biggest organ in the body is the endothelium, which is the single layer of cells that lines every blood vessel. So when you smoke one cigarette, you knock off your endothelial function for an hour, which is just ridiculous. And so you're damaging your endothelium with every cigarette, allowing muck to get across the lining of the blood vessel into the wall of your blood vessel, damage the blood vessel, so the blood vessels just don't work as well as you get older, setting up for hemorrhagic stroke and for ischemic stroke. Alcohol in low doses, no big deal. But in heavier doses, so more than three or more alcoholic drinks per day, it's a cellular poison. Poisons the brain, poisons the heart, the liver, every cell in the body, and can also push up your blood pressure, make things so much worse. So you've got to get, and illegal drugs. I mean, people say, oh, having a joint's okay. No, it's not. Again, within 2 hours of smoking a joint, you increase your risk for a heart attack and stroke 5 times. have a snort of cocaine, your blood pressure goes through the roof, you rip open your arteries. I mean, these things are so bad for you.
We're saying not to snort cocaine, just in case.
I'm definitely saying, don't use any illegal drugs.
Any illegal drugs,
at all.
There's a reason why they're illegal.
Yeah, they're not recreational. They're poisons that kill you.
Okay, so you mentioned about smoking. That what you said was fascinating, like the hour of clogging. Is it the same for vaping?
Yeah. Oh, yes. In fact, I'm glad you asked me that question. Studies have been done now comparing vaping to smoking, and vaping actually causes more endothelial damage than the horrible endothelial damage caused by cigarettes. So vaping is poison. You see, when vaping first came out, everyone said, oh, no, it's better for you than cigarettes, blah, 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 blah. But it's only now that vaping's been around for 10 or 15 years, people are seeing the damage. When smoking first came out, when people were doing it when I was a kid, doctors used to encourage people to smoke as a form of stress relief until the 20-year data came out. No. Vaping's horrible.
Okay, awesome. Tell me about sleep apnea, Ross. Can sleep apnea increase risk of stroke?
Oh, absolutely. For two major reasons. When you have sleep apnea, it drives up your blood pressure, number one. So treating sleep apnea reduces blood pressure. But number two, when you have sleep apnea, it's like someone's got their hands around your throat. So you're basically being choked of oxygen. And when you choke the brain cells of oxygen, that may just tip the plaques over and induce a stroke. Oh, absolutely. Sleep apnea is a horrible condition in terms of its relationship, especially to stroke and high blood pressure.
I feel like there are so many things in our life that impact our heart. Like, sleep apnea might not impact, like your kidney, but it will impact your heart. Same with all the things that we do. It's like every little thing impacts our heart. So you really are in the most important profession, Ross. I love it.
In a job, that wonderful pulsating thing in the thorax.
I love it. What do you think of bionic hearts? Do you think that'll come in one day where we'll have
they're
metal hearts? Really?
They're already in. The bionic hearts have already been developed, and they're being used as a bridge to transplantation, and even possibly as for people who can't have a transplant, just to at least give them a relatively normal life. But at the moment, they have been developed, they are being used, but it's certainly the end stage therapy.
Does that mean we could TikTok forever?
There are other issues. We'll have an anti-aging podcast. We'll talk about all that.
If I could give my dog a bionic heart and make her live forever, I'd be so happy.
Yeah, but there are other parts of the body that have to hold up with that as well. It's not just the heart. It's the whole body, the brain, everything else has to be working well.
Yeah, that's true. Okay, it's a good point. Okay. Now, I know we've got a member question of the week. Rossa, do you want to read this one out?
Okay, we've got this question from Fran. What is the difference between the mind and the brain? Now, you're an expert in this area, Gina. Please tell us.
Well, our mind and our brain, they're not the same thing, although they both do have tremendous power over our body and our actions. Our brain is a physical organ. It's part of a visible, tangible world of our body. It's composed of, we've got neurons and cells, and it uses electrical and chemical signals to communicate with itself and with the rest of the body. Our brain is a physical structure that enables our mind to exist and to function. Our mind is a more abstract concept, and it refers to sort of the subjective experiences and mental processes that emerge from the activity of the brain. So our mind is part of an invisible, transcendent world of thoughts, feelings, attitudes, beliefs, emotions, perceptions, memory, and imagination. Our mind is shaped by a lot of things, like our genetics, our environment, our experiences. Day after day, it's actually building and it's reprogramming our brain. I like to say that the mind and the brain are a unified system because as the brain changes, the mind changes. And as the mind changes, the brain changes. So although they are separate things, they definitely are unified. Ross, I'd love to hear your thoughts on this question. What is the difference between the mind and the brain?
Okay. Well, I have my own thoughts, but let me say there is a very strong and prominent group of people who work in the field of consciousness who firmly believe at a reductionist level that everything can be explained by the chemicals going on in the brain tissue itself. Now, that may be the case, but they have been striving for years to find the centre of self in the brain. And so we all look at something that's red, but we have different perceptions of what that red is. So what is red to you and red to me is probably similar, but what it evokes inside of us, that can never be, well, to this point, and science is only as good as its testing equipment, but they've never been able to say, what is the source of self-perception? What is the source of self-consciousness? So I look at life pretty straight. And this is, I have absolutely no science to back up what I'm about to say, but I'm just giving you my own perception on this. There are two potential explanations of life. One is you're born, good luck, bad luck, you die, and then you rot in the ground. That may be the case. I'm not arrogant enough to say that I know either side which is right. That's one explanation for life. So, but it makes life pretty purposeless in my view. Two, there is some background higher purpose to life that might be through religion or through what some people call God. Many spiritual people call it a universal consciousness, where there's something well beyond the tangible physical world. And to me, that gives a much better explanation of the mind, because, again, I make the analogy of a computer screen or a TV where you see a television show. Now, the people who are in that show aren't in the television. They're being transmitted into the television. So if you believe in universal consciousness, that what is going on in your brain is really a compilation, as you so beautifully put it, of all the different experiences you've had in your life, the genetic aspects of going on that are going on, and different people have different levels of self-awareness and self-consciousness at different parts of evolution. So I think life's about one thing. I think it's about spiritual evolution. Now, I'm not talking about religion. I'm just talking about becoming better at everything you do, every moment of the day, every day of your life. And I think that's what it's about. And I think there's a purpose to it. At the moment of your death, you may rot in the ground. I don't know. Or at the moment of your death, what some people call the spirit may go somewhere else, and I don't know where that is. But all I'm saying is that that's the way I live my life, that there is a purpose. And I think all of us need to have a purpose. That purpose might be a physical, material purpose, such as just your family could be your purpose. I don't care what it is, but I put the plea out there to everyone, whether there is a mind, whether there's a brain, whether there's two separate entities, but the plea I put out there to everyone is have a purpose in life and live to that purpose.
Yeah, I've read a lot of research in the longevity space that shows that people that do believe in higher power tend to live longer, they're more satisfied, they're happier, and they do have a greater sense of purpose in their life.
Yeah. Or people who just have a sense of purpose, and that, as I said, the purpose might be volunteering. It might be their community. It certainly may just be their family. It could be their religion. It could be their work. I don't care, but we've got to have a purpose. We've got to have something that gets us out of bed in the morning, something that drives us, something that makes us passionate.
Yeah, love it. Thanks, Ross. Well, that brings us to the end of this week's episode on Eat, Live and Move with Miyagi. Whatever platform you're listening to, please hit subscribe. And that's all from us. Thanks again, and we'll see you next week for more conversations with me, Dr. Gina Cleo, and my co-host, Dr. Ross Walker.
Bye.
Bye.